Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hello, I am your doctor, Dr. Minal Chandra. I am the co-founder of Epione Pain Management Center. Today I'll be talking about sciatica. So very commonly this term is used because this is a very prevalent condition all over the world, and especially in India, almost like 30 to 40% of the population will suffer with sciatica pain once in their lifetime. Now, what is sciatica? Sciatica is a pain which starts in your back or in the buttock, and then it will start going down to your legs. It can be on one leg or it can be on both of your legs. Now, what are the other things that can be associated with sciatica is tingling, numbness. You feel burning sensations in the feet or in the fingers, and you may feel that the leg is going numb. Sometimes our patients also explain that the leg is getting heavy, and so these are the symptoms, these are the ways the patient explained to us: tingling, numbness, heaviness, burning sensation. So anything of such sort that you're facing could be a sign of sciatica. Now, who all are prone for sciatica? So sciatica is something that can happen in young age and also in old age. In young age, most commonly what we see in our practice is, patients coming from gym. So they go to gym and they don't do their warm-ups, they're not well trained, and then they start doing weightlifting. So this is a very common cause. Second thing is software people who continuously work, continuously sit on the chair, they don't have any physical activity throughout the day, the posture is wrong, and continuous straining of your back with improper posture may lead to any impingement of your sciatic nerve. Then in old age, because of degeneration, because your muscles are weak, your body is not able to hold your spine weight properly. So degeneration of the spine, of the joints in the back can all lead to sciatica pain. Obesity is one of the very common cause. Because of your weight, the abdominal pressure is so much that it gives a lot of strain to your back. So keep a check on your weight. Obesity plays a very important role in any patients having sciatica. Now, should we worry about it, or should we go with lifestyle modifications or certain treatment? Definitely you should worry about it, because this is not a good sign. So if your pain is not subsiding in a couple of months after taking painkillers and after doing exercises and all, definitely is the time that you should go and see your physician. They will do examination, and then they have to find out what is the extent of damage. It's just a muscle pull, or it's just a mechanical back pain, or it's actually a nerve impingement that is compressing your nerve inside. So doctors have few tests. We do few tests to identify whether there is a serious damage happening inside or not. And once we feel that yes, it needs to be evaluated further, then we go for MRI. MRI is the best thing that can diagnose your sciatica, because we see the nerve compression, we see at what levels the compression are there, we see what is the extent of compression that is happening. Once this is done, then we can form a protocol and give you a customized treatment. Now, why customized treatment? Because not the same kind of protocol will work for all patients, because everyone have a different body type, everyone have a different lifestyle, everyone will be differently reacting to the tablets. So a customized protocol is very important. Now here, one thing which we all need to understand is whether you have red flags or not. Now, what is red flags? Red flags is when you cannot hold your urine in motion. That means when you do not feel the sensation of urination or passing on the stool, and you just pass it on. So that is one red flag which you need to identify. Second red flag is that you have developed weakness in the leg. Weakness in the leg means you are walking and you tend to fall. So these two conditions is red flags, and if you have this, make sure that you see your doctor urgently, because red flags needs to be evaluated on an urgent basis. But if you don't have red flags, you don't need to worry, but you need to be concerned about it and take good care. So you need to see your doctor once they have evaluated it and they have formed a protocol for you. You have to follow the protocol. Now, How do we make a protocol? So the first thing is understanding the lifestyle. We need to make certain lifestyle modification. For example, if you do not have any physical activity, make sure that you include some kind of physical activity. If you have improper posture, you have to correct your posture. If you have continuous sitting at the or have a desk job, make sure that there are arrangements which you do so that you have a continuous movement. Like after sitting for 1 hour, you make sure that you walk for 5 minutes. So all these lifestyle modification is important. Like I said, if you are obese or your weight is more, you need to keep a check on your weight, because weight plays a very, very important role. Then certain core strengthening exercises which a specialist rehab specialist should tell you, follow that. There are lots of things which are present online media. Do not follow that, because not all exercises will suit you, and sometimes these exercises may also exaggerate your pain. So you need to see a rehab specialist who will identify which core strengthening exercises will suit you. So you need to do that. If you are a gym person, or if you are into doing a lot of exercises, make sure that you do a lot of warm-up exercises before you are doing your gym activities or you go into weightlifting. Then we can come to pharmacological treatment, that is the medicines. Now there are lots of medicines, but because this is a nerve impingement, you need to take certain anti-neuropathic tablets, and these anti-neuropathic tablets should be prescribed by the concerned physician only. So we have a lot of painkillers. These painkillers are not going to work on your impinged nerve. You have to take a certain class of drug, that is anti-neuropathic tablets, which your physician will prescribe you. These tablets do not show immediate results, so make sure that you take it as it has been prescribed by your doctor. And again, if these things are not working for you, then we can go and decide for certain interventions. Now we have lots of interventions where with the help of small injections, these impinged nerve can be corrected, your sciatica pain can be corrected. So we have certain nerve blocks, we have regenerative therapy or plasma therapy, we have radiofrequency ablations, we have epiduroplasty. So small interventions which are done as a daycare procedure with the help of a small needle can immediately take care of your pain, and you can get rid of your sciatica pain. And finally, surgery. 95% of the patients suffering with sciatica pain do not need surgery. Surgery is only required if you have a very huge or an extruded disc and you have red flags. So make sure only if you have red flags to opt for surgery, because surgery near the spinal cord, near the disc is not an easy one. So make sure that you go stepwise and follow your physician's instruction as per has been prescribed by you. And this is going to take care of your sciatica pain. Sciatica is common, but definitely treatable with good results. But again, it has to be in a way that your physician is helping you out and you yourself is helping yourself, because once you contribute by lifestyle modification and following the instruction, we are going to get good results. Thank you.